Hello, everyone, and welcome back to the UB Medicine Podcast. I'm Dr. Allison Bashir, the Dean of the Jacobs School of Medicine and Biomedical Sciences and Vice President for Health Sciences at the University at Buffalo. Today, we're talking about a serious issue that touches every aspect of community health: gun violence. At the Jacobs School, we've long understood that better health outcomes depend on what happens in the clinic, in the hospital, in the laboratory, and in our community. These are shaped by conditions in which people live, learn, work, and connect with one another. For many of us in Buffalo, this conversation is deeply personal. The May 14th, 2022 shooting at the Tops Friendly Markets profoundly affected our community. Faculty, physicians, health professionals, and trainees and students across Buffalo cared for victims, supported families, and witnessed firsthand the physical and emotional impact of violence. That reinforced something that we already knew. Gun violence is not only a public safety issue, it is a public health issue. It is also a reminder that healing requires collaboration. No single organization, profession, or institution can address these challenges alone. Several years ago, the Jacobs School launched what has now become the Rise, Respond, and Rebuild Conference as a way to bring together health professionals, educators, community leaders, advocates, researchers, residents, and our students to have difficult but necessary conversations about the effects of violence on individuals and communities. With what began as a response to tragedy has evolved into an ongoing commitment to healing, partnership, and action. As we prepare for the 2026 Rise and Respond and Rebuild Symposium on September 11 and 12, we're exploring today how Buffalo continues to move forward, supporting trauma recovery, advancing prevention efforts, and strengthening the partnerships that make lasting change possible. I'm so pleased to welcome two leaders who've already been deeply involved in this work. Adrienne Garr is the Executive Director of Buffalo's Office of Gun Violence Prevention. She is a respected social worker and violence prevention leader whose experience includes the Snug Street Outreach, Erie County Medical Center, and years of direct service supporting individuals and families affected by violence. We are also joined by Eddie Payne, Community Coordinator with the Erie County Department of Central Police Services. Eddie works with organizations throughout Erie County to advance collaborative, public health-driven approaches to reducing gun violence and strengthening community safety. Both Adrienne and Eddie also serve on the Executive Planning Committee for our Rise, Respond, and Rebuild Symposium, helping shape the conversation and partnerships to make this gathering possible. Adrienne and Eddie, thank you for being here and for the work that you do on behalf of our community.
Yep, thanks for having us.
Well, we're going to get right into it here and talk a little bit. First thing we want to do is talk about healing, partnership, and community resilience. One thing that strikes me when we think about Buffalo over that last few years is how many people and organizations have stepped forward to support healing and prevention efforts. You both had a front seat to that work and have been deeply involved personally and professionally. Tell me, when you look at where we are today, what gives you hope and what progress do you see being made with people outside this work may not always recognize? And we'll start with you, Adrienne.
I think what gives me hope is that the work continues and that there's a lot of support just still coming in. When you have something like a hate crime happen in your community, it kind of made, national news and all that other stuff. So I'm hopeful because us as the city of good neighbors, that work has continued. I've seen a lot of organizations, and not just organizations, just people as neighbors, like block club leaders, people from different disciplines, people from different spaces and places just come together to ensure like safety and community and to try to ensure that we're, checking on each other. So that actually gives me hope. So
So, Eddie, what gives you hope?
Absolutely. I would say what gives me hope is being able to see that there's a growing mutual understanding that addressing gun violence isn't just about the way we respond to it or what happens after it has occurred, but more importantly, it's about fixing or enhancing the environments or systems that people live, work, and play in, so that these shootings never happen in the first place.
That is such an important point. One of the biggest challenges in healthcare is, as you just mentioned, is not solved usually by one organization alone. It is a bunch of people coming together to solve a big, complex issue. And the same is absolutely true about violence prevention. So, how have partnerships evolved in Buffalo over the last couple of years, and how are people working differently together now than they were? Eddie, we'll start with you.
Well, I would say, organizations are recognizing that there isn't one single entity that can address gun violence. Everyone has a willingness to pitch in. Everyone is asking, okay, what role can we play in reducing gun violence? And I think that's a major change, because at one point in time, gun violence was looked at as something that only emergency responders were, supposed to be working towards addressing. So I would say that's been a major shift in people's willingness to collaborate, is that acknowledgement that it takes all of us.
Okay. Adrian, what have you seen change?
And I would agree. So more groups are coming together organically, and it's not exclusive to community violence intervention partners, like the Jacob School of Medicine. Is we're doing, our event here together. We initially called it R3. So it's the Jacob School of Medicine. It is also, again, I mentioned block clubs a lot because they are actually really close and connected in community, from them getting funds to, do a garden, which is preventative, from them showing up at different things that might not be traditionally where they would show up. I'm seeing organically CVI partners who may have worked in their silos just come together, like say, hey, can we do this event together? Can we talk about these youth that we both interact with and what's going on with them so we can get a better solution? So I'm seeing more organic partnerships.
So Eddie, we're gonna nuance here a little bit, but we hear, gun violence as a public safety issue, but we're trying to really change this as a public health issue. That was the really impetus for the symposium that's now moving into its fourth year. I'd love your perspective on how that helps change the conversation, the funding, the attention.
Absolutely. If I had to put it into one phrase or one sentence, I would say a crime to solve versus a health crisis to prevent, right? So again, leaning into the idea that it's not so much about how emergency teams respond to it, but how can we work collectively to prevent this community vulnerability that is obviously affecting the health and well-being of so many people.
That's terrific. Adrian, what happens when we begin to look at things through a public health lens?
I think what happens is it's less criminalized, and you put a human element to it. So when it is a public health issue, you're looking at other factors that are contributing to, a phenomenon like a disease. So you're looking at the behaviors associated and the risks associated. Also, you're looking at what can be a protective factor, what can make things safer for communities versus it being, not just a lot of times when we talk about like gun violence and incidents happen, there's a way that not only are individuals, criminalized, but it's almost like the whole community gets criminalized as well because the activity just happens to be happening in one area more than another. And so when you look at it as a public health issue, you're just looking at other factors for prevention and how to actually put that into practice for the long term.
So in medicine, we talk about ways to prevent illness rather than just simply treat the consequences. Hypertension's a great example, right? You treat hypertension and you prevent heart attacks and stroke and kidney disease, et cetera. And so I think we're beginning to really have this conversation about how do we prevent violence. And so, what are some of the things that are going on in the Buffalo community as affecting the upstream, as you mentioned before, whether that's either access to guns, other activities? Just give me some examples of what's going on.
So I think the most recent example that I can think of is probably because I was at Buffalo Snug for so long. So for those who don't know, Snug is actually a statewide program, and Snug stands for Should Never Use Guns. So this is a New York statewide initiative. Buffalo is one of 14 sites. And so what they recently had was like this huge community day back in June called Snug Day. It was right at MLK Park. So it brings the community out in a safe way. But what also happens is Snug has young people who participate in the program who may have been victims of gun violence. They may have been perpetrators. They may be on parole, but they actually come to the community event, and there's never any friction at that time. There's games, food, all of those things. So it's activities like that, and a lot of other things that they do that are protective factors. Because one thing that I have noticed with youth who kind of participate in some of this riskier behavior is there is a disconnect. They're not sure where they fit in community. So that's one of the things that I've noticed over time. So having events like that helps, one, give them an option, um, to do something kind of positive with themselves. And then two, you know where they are. So if they're sitting in front of you, they're not kind of participating in stuff that will risk their lives. So those are some of the things that are happening.
So, Eddie, you have a perspective in your work with police. Tell me a little bit of things that have gone on in your world about prevention.
To be honest with you, it's been a bit refreshing because as speak with some of those around me, you can see that there's that shift in understanding that, like I've been mentioning so far in this podcast, it's not so much about the way we respond to what's going on, but trying to gain a deeper, level of understanding about the environments that people are, forced to exist in, and how that contributes to many community vulnerabilities. If I'm being honest with you, community violence is just one of many things that actually presents itself when there is a lack of investment in communities. And so I would say that's been one key perspective, is listening to the conversations and hearing even them wanting to know how they can contribute to prevention, because even they're like, hey, like when we took these jobs, we didn't take it because we wanted to arrest people. We took it because we wanted to be a blessing in our communities. And so they're finding ways to give back, which includes finding ways to be involved in prevention.
Oh, that's so well said, really. So at the Jacob School, we tried to create opportunities for people to come together from a variety of different places, whether it's here in this building, reaching out in the community, or doing the organizations like the program that we're going to put on in September. What happens when we have these community leaders, health professionals, students, residents all come together? Because I am a big believer that diversity of thought really helps us move forward, and so give us your view of what happens when we bring all these people together and come up with, does that give us new, different ideas, different experiences?
It's been my experience that that has always been the case when you bring people from different disciplines, different experiences. And it's not just because they're in a different discipline. It's like their life experience. So they think differently. They probably have a better idea than you might. So I think when you bring everyone together, you get better ideas for how to take on the challenge of like gun violence prevention and what is possible. And then even, some of what the limitations might be. But it's always, I think, best to bring in people from different places. That's just been my personal experience, is that the best ideas come from bringing together people from all across everywhere.
I couldn't agree more, Director Dyer. I would say, presenting folks with a space to come together, it allows for enhanced collaboration, but it also allows you to learn more about what's going on in other parts of the system, because sometimes we unintentionally make assumptions about the way other teams are supposed to exist or function. And it's not until we're all bought into the same space that you begin to learn more about, why these agencies may be operating the way they do. So I think it allows for enhanced collaboration and increased learning about, like I said, other parts of the infrastructure in place to address gun violence.
That's an excellent point. Excellent point. So let's pivot just a little here. Adrian, before you began leading Buffalo's Office of Gun Violence Prevention, you spent years working with families and individuals through SNUG and at ECMC. How did those experiences shape your leadership, and then how you help counsel individuals in terms of days and months and years after the trauma?
I think working with like survivors of like gun violence, I think how it shaped me is more than anything. I probably have a little bit more urgency in how I move when it comes to assisting these families when engaging systems that do not move urgently. So I was very skillful and actually, I think that's probably why it works so well, because I'm a social worker along with my other social work colleagues, just through collaboration and good relationships, trying to get the process to get direct funds and whatever direct services needed to these families as fast as possible, despite the challenges with some of these systems. So in my leadership role now, that urgency is still there. But navigating that in a new space has been it's been interesting, I'll say. So my skills are definitely getting a workout for sure.
Well, we so appreciate that you bring your experience to your leadership role here. So, Eddie, let's just talk a little bit about how you see the pieces fitting together, because you both have different perspectives, but they all are very much needed. So, how do the pieces fit together in terms of prevention and recovery?
Absolutely. How do the pieces fit together? Good question. Well, as I previously mentioned, not one agency can do it all. It's a matter of, different teams knowing their role and knowing their goal. While mental health experts may be able to lend expertise or supports in the manner that they can, that, may not be the exact same way that medical physicians can lend a hand towards gun violence prevention, but nevertheless, there, like I mentioned, is a piece of the pie that everybody can take. And one thing that I wish to highlight, if I may, is that the pieces of the pie are not just for folks who hold a title that is tied to an organization, right? If you're a parent, if you're a neighbor, right, there's a role for you to play as well. And so I see even those pieces as intricate pieces of the puzzle that is necessary for us to mobilize if we really want to make a dent in gun violence.
So, the Jacob School, in collaboration with many medical schools, including Michigan State, have really continued to support the Rise, Respond, Rebuild Symposium, for which we're so appreciative. And one of the reasons we do that is because I believe that academic institutions and students in particularly need to hear from communities. So what would you like the future physicians and people who will come to know about the importance of listening and earning trust from the communities they serve?
I guess the best guidance I could put is probably just expanding that capacity for empathy and just realizing there is an individual presenting in front of you. And yes, there's a lot of time and money invested in the medical piece, which I think is amazing because that is not a field that I went into. I went into the other part, but I would just encourage them to expand their capacity for empathy, and just realize that it's not just a system sitting in front of them, but that is a person that's a part of a family and that there's a human sitting there, and just trying to practice that, because when gun violence visits a family, it's a very disruptive type of thing. And sometimes the person that's the medical person, they can be kind of a bridge to making it a little less horrible for the family, along with everything else going on. So that's what I would recommend.
That's a great point. One of the things we try to teach our physicians and residents is that, there are other issues other than just the medicines. The person where they live, their education, economics, safety, all these things play into how people may respond to in gun violence event, but also how they're going to heal. It's multifactorial. So balance is really important as we think about the upcoming symposium and the community voices. And we have different voices in the room. If a physician or health professional is listening to this today and they want to become a stronger community partner, where should they start? Eddie, I'll start with you.
I would start with listening and viewing the world outside of the clinic as a training ground. In my view, that's what it is. There's a lot of context that the community can give you that has to do with so much of the content that they're taking in. A lot of times we take in content without the proper context. And so I would encourage them to strive to view, again, the world outside of the clinical setting as a training ground. Come with an open mind and open heart, be willing to listen so that you can gain that context.
That's a perfect way. Context and content. Great. Adrian, what would you wish people to know?
Mine's probably a little bit simpler. I would say to maybe, come outside, go to, attend a community event. I know Councilwoman Everhart and the President, Kyrie Stevens at Intersect Buffalo and myself a couple weeks ago, we had a big community meeting just because of all of that activity that we had over 4th of July weekend. We had a lot of victims, and we had almost, 400 people in the room. I'm pretty sure there probably weren't any medical professionals in the room, but for things like that, like come out to a community meeting, go to a community event, and I don't know time-wise what some of these students deal with, so it might be a little bit of a challenge. But I would invite them to come out to different community events to see just the community in a different light. And it might help give a better understanding to what they, their patients might be dealing with, when they go back home and what they see. So mine's a little simpler. Just, come on outside with us and
that's
see what it is we're doing.
Well, I want to thank you both for really coming out today and talking with us. It's so important. And one of the themes is that healing's not something that any one person or any one organization can accomplish alone. It really requires trust and partnership and compassion and community. And as you said, really coming together and come outside and ask what is needed. As a medical school, we realize that health is shaped much more than by just the clinical care that we provide. And it's really, our communities are why we're here, why we do what we do. And our mission is to really take the education, research, clinical care, and weave that together in partnership with the community to improve health. And one of the ways we do that is by assisting and working side by side to try to decrease gun violence. I want to thank you in advance for all of your work with the Rise, Respond, and Rebuild conference. We really are excited about the lineup that we have: community leaders, health professions, advocates, residents, students, faculty. I hope everyone listening will join us on September 11th and 12th at the Jacobs School of Medicine and Biomedical Sciences. And you can learn more about the conference at Jacobs School at medicine.buffalo.edu. Thank you again for coming out. Thank you to everyone who's been listening and downloading and liking our podcast. I'm Dr. Allison Brashear, and until next time, please take care of yourselves and one another.